So hi guys, welcome back to the residency series, and this is going to be video number 4 in this series. In this video, we'll be talking about the labor room and the emergency exposure. So labor room is the heart of the residency, and I'll talk about what you can expect and what you can be going through during your labor room postings, and what things are expected as cases or as your responses, and how you should be, you know, going through the labor room duties. So just stay with me and listen. So as I told you, labor room is the heart of the obs and gynae residency. So in your whole 3 years of residency, if there is one place which is going to teach you most of the thing, is the labor room, because most of your confidence, your clinical judgment, your awareness will be built in this section only, in the labor room duties only. Okay, it will be very exhausting. Your labor room duty will be very exhausting. It will be very stressful. It will be very chaotic. I know you will feel sometimes it is a machli bazaar, but this is the place where you will learn the most. So labor room is going to be your new classroom. As a new resident, as a first year, second year, or even a third year resident, you are going to spend most of your time in here only. And textbooks will teach you the theory, but labor room will teach you the reality and the practical things. So what you will learn in the labor room, you will learn about the progression of the labor, you will learn about how to assess patients quickly, you will learn about how to recognize the danger signs, you will learn how to make decisions under pressure. You will be under very much pressure in the labor room because the time is ticking, and you know some mishaps can happen within seconds, within minutes. So you have to take the decisions wisely and in so much lesser time, in a reflex that we feel that there is so much of stress and built up pressure on you. But we all learn in that way. We all learn to be quick and have our decision as a reflex in this labor room only, and you will learn it too. So just try to bear with the labor room. Okay, initially it will haunt you, it will make your heartbeat go faster, tachycardia, but you will enjoy this place after some point of time. You will learn how to communicate with patients, you will learn how to communicate with nurses or other staffs, and even while counseling the relatives, you will know how to talk, how patient and how empathetic you have to be while talking to patient and the relatives. All these things you learn in the labor room primarily. So this is very important. And just remember that no amount of reading can replace the learning what you will be learning in this place. No amount of book reading, no matter how much bigger book it is, the learning in this place cannot replace any, cannot be replaced by any other things, by any other books or videos or whatsoever. So labor room is the most important place of your residency. Okay. So the next thing is what you will encounter in your labor room, what you are expected to see and manage in the labor room duties. So most commonly you will see normal labor and deliveries, and in that you have to assess the patient on admission. You have to do vaginal examinations to know about the cervical dilatation, effacement, cervical length and stations, and many other things. You have to monitor the labor progress, you have to conduct normal vaginal deliveries, you have to repair the perineal tear and episiotomies, and you have to provide immediate postpartum care. Okay, so these are the things you will be learning in the labor room. So the next thing you will encounter after doing this normal deliveries and episiotomy and perineal tear repairs are the high risk obstetric cases. Many of the time, these high risk obstetric cases will be admitted in the labor room for monitoring purposes, and that is how you will learn how to manage a patient with preeclampsia or eclampsia, with uncontrolled BP or GDM patient with uncontrolled sugar and having some fetal complications like macrosomia or polyhydramnios. You will see patients of severe anemia with uh, severe symptomatic anemia, and you have to prevent the heart failure in that patient. So you will know how to manage a patient of severe anemia while giving blood, what things you need to monitor, how frequently to monitor the vitals, and you will learn the management of all these cases na, in labor room. If you are giving trial of labor to a previous cesarean patient, the management is not same as managing a patient of who is undergoing a normal process of labor. There are uh, more frequent monitoring. You have to see for scar tenderness every now and then. You have to be more careful about the fetal heart rate tracings in multiple pregnancies. If the first twin is cephalic, you are giving a trial of vaginal delivery, or you are managing MCMA twins in your labor room, uh, who is admitted, in 30 weeks with some complaints. So you know that any of the time anything can go wrong, and you have to be on your toes and very careful, and you should know all this management at your fingertips so that nothing is missed and both the mother and babies are fine. And if a patient is in preterm labor, you will be knowing you have to give steroid cover for fetal lung maturity. You have to give neuroprotection for the fetus if it is at 28 weeks or 30 weeks or so as per your institutional protocol. And you have to manage a patient of FGR also who is admitted with Doppler abnormality like AEDF or REDF in the labor room, and when to deliver, what things you have to consider while delivering. So you have to know all this management so that you manage these high risk cases in your labor room. So all these cases which you see are full of complications which may happen any time, and you have to be on your toes so that you can prevent a complication before it can develop. And you can only do it if you know the subject well, if you know these cases well, if you are aware during your rounds, if you give ear to what your consultant says, and you come back to your home and read at least for an hour or so. So you know, if your mind knows all this, your eyes can pick up the complications earlier, and you can prevent some morbidity and mortality in these cases. There are some obstetric emergency which can happen anytime in the labor room, like PPH. This is the most common preventable cause of maternal death, maternal mortality. So a patient who has delivered a baby by vaginal delivery, and she was well now only, but when you went to check her up after half an hour of delivery, you saw she is lying in a pool of blood, and her uterus is atonic, and she is pale and white, and she is unresponsive. Then you know that how fast the condition of the patient can change, and so you have to be aware and monitor your patient for you have to give close monitoring, because even a normal patient can go into so severe complication that can lead to the loss of life. So you know how to manage emergencies, you learn how to manage it and how quickly to manage it in labor room. You will learn early recognition, you will learn medical management, you will learn team coordination, and you will learn when to escalate to surgical management. Okay. And you learn all this by seeing, not only by reading. In labor room, you will see all these cases, and that is how we are going to learn. The next emergencies can be eclampsia and severe preeclampsia. One of the reasons obs and gynae is of so much demanding and exhausting subject, because emergencies can develop anytime. So a patient who is admitted for BP monitoring in your labor room can develop eclampsia at a sudden, and By seeing and managing these cases, you will learn rapid assessment, you will learn stabilization, you will learn magnesium sulfate protocols in patient of eclampsia. You will learn how to monitor and how frequently to do maternal and fetal monitoring, when to take delivery decisions to to save the mother and the baby from developing complications. So you will see these cases, you will see fetal distress cases, and you will learn to recognize what is late decelerations, variable decelerations. You will learn to recognize acute fetal bradycardia, and you have to rush the patient to the emergency cesarean section. Sometimes you have to do category 1 cesarean sections, as in a case of cord prolapse, placental abruption, uterine ruptures, and you have to be so quick that the patient has to be under GA, and you have to just take out the baby as soon as possible so as to prevent the stillbirth or the birth of an asphyxiated baby. So all these things you will be learning under so much pressure. At first you will be so lost, you will not be knowing what to do, how to act. You will get so much of scoldings, but with time you will learn about these cases, you will see these cases. The more and more you see and observe, the more and more you learn. Okay, so with time, you will learn to take decisions. You will learn how to prioritize your patient, what things to give more attention to, and you will learn effective communication as well with the team. So the next thing is knowing when to call for help. Sometimes we think that we are capable enough to handle everything alone. We may be, but the time may not be thinking so. So sometimes you have to ask for help, uh, and that becomes the most important and the first step in management of many emergencies. That is call for help. So never think that you will handle everything alone, because you have only two hands only, and you cannot do everything alone. You cannot monitor a patient or take sample or catheterize at the same time. You will need many hands, and you should know when to call for help, and you have to call it at earliest. You should not be waiting. Okay, I'm unable to do it now, so I'll call now. So don't do that. You have to call for help at the first, no matter whoever is nearer. Be it any nursing officer or your juniors or your senior, you have to shout for help. The real skill lies in recognizing what you can manage and what you cannot manage alone. Okay, when you requires the input from your seniors, advice from your seniors, and when you need immediate escalation, knowing all this thing is so much necessary than being recognizing yourself as I know all person. So the emotional side of the labor room is very intense, and learning to manage these emotions, processing these emotions become an integral part of becoming an obstetrician. So in a single shift, you will experience the joy of a healthy delivery. You will see the happiness in mother and the family. You will feel relief after managing an emergency successfully. Suppose a obstetric topic patient came collapsing, and you managed her on time and you saved her life. So you will feel so relief. You will feel frustrated during some difficult cases. Suppose you are managing a BPH after a cesarean section, and you have taken uterine artery, you have ligated the artery. Still, there is so much of bleeding. It's not even after internal artery ligation. There is so much of bleeding. It's not controlling. Then you have to call your senior and consultants and proceed for cesarean hysterectomy. So sometimes it becomes very frustrated, and sometimes you'll develop so much of anxiety while managing a critical emergency cases. So all these are the emotional side of a labor room, and slowly and steadily you will learn processing all these emotions. Why residents grow so fast here? So the labor room accelerates your learning. Why? Because you have to take decisions which have real consequences. You have to give feedback which is immediate. Why? Because suppose PPH happens, there is one intern or there is one another JR. So you gave or you told your JR, please put another cannula. You told the intern to draw the sample and arrange blood. Then you called your senior and you told them about the patient's background and everything. So you have to give immediate feedback. Your reputation builds competence. So you reputation in the sense of managing similar cases or telling what to do, which is what is necessary again and again. So this will bring competence in you. Every shift presents new challenges. So your everyday will not be same. Sometimes you will have emergencies, sometimes you will have high risk cases, sometimes you will have a normal delivery and chill duty. So every shift will be different, every shift will be having new challenges. Sometimes it will be cord prolapse, sometimes it will be ruptured uterus, and you will learn so much here only in labor room. I don't think that residency means learning from books only. Most of the time you will learn from your patients and labor room. And my closing message will be that labor room will be so much overwhelming. Labor room duties will be so much overwhelming when you will be starting your residency. There will be nights when you are so much exhausted, you are so much confused, you are keeping asking for help from your seniors, you will feel lost. But just remember that that is normal and that happens with everyone. Every confident obstetrician which you see now, or every confident resident or your seniors which you see now and admire now, has gone through the same process of learning, and they have become more confident and competent as they are now, only because of the grinding and the pressure which they feel in the labor room. So most of the learnings happens in the labor room. You will be exhausted, you will be frustrated, but don't give up under the pressure. Try to learn, try to recall the cases which you have seen the last day and how you have managed, where you have gone wrong, what better you could have done, and take feedbacks from your seniors because they have gone through the time which you are going now, so they can guide you better. So take help from your seniors and learn to act faster and call for help whenever required, and just enjoy your posting. Don't think that you will get much of the free time during your labor room posting. You will not be getting. Don't keep expectations for the work life balance during your labor room posting. People try to eat, sleep, and drink water whenever you can, and try to go back to home and read for some time the cases, at least whatever you have seen in the labor room. Suppose hypertension or previous cesarean section undergoing trial of labor or a obstetric topic case. So if you read the same topic uh, of the patients which you have seen cases in the labor room, you will remember it for a longer time, and that will be retained in your mind mostly for your residency period at least. So try to do that and build the resilience and the teamwork along with that, and you'll be fine. So thank you for watching this video, and keep liking and subscribing to my channel and watch for more videos. Thank you.